Hey guys, it's Dr. Potter. There is a bill that has been introduced in Congress that on the outside looks like it might be a really good thing for the patients that I care for patients affected by breast cancer. But on the inside, there's some real problems with it. And I need your help in raising awareness about that. So when I see a patient who has breast cancer or a risk of breast cancer, there's one thing that I always say to them, and it's so important. It's that the Women's Health and Cancer Rights Act of 1998 guarantees that if their insurance company covers their mastectomy, they have to cover their reconstruction. So as you can imagine, when women hear that, they're so relieved, right? They're like, okay, I have to lose my breast, but I'm going to be able to have reconstruction. There's also some problems with the act as it stands, like we don't have coverage for flat closure, for reconstruction after partial mastectomy or lumpectomy, for surgery to treat and prevent lymphedema, for the deformities caused by the diagnosis of breast cancer and biopsies. And we don't have coverage that expressly talks about the really modern types of breast reconstruction, so those that don't sacrifice a woman's muscle. So I heard about this update to the Women's Health and Cancer Rights Act. I was excited to get to see what was in this bill. However, when I read the bill, I was disappointed. I'll tell you some of the major problems that I saw. So the number one thing is that previously in the Women's Health and Cancer Rights Act, coverage for all breast reconstruction really hinged on one thing, and that was if your insurance covers your mastectomy, they have to cover your reconstruction. When I read this new bill, I looked for that, and what I saw was that they had changed that fundamental thing. They changed that to say now reconstruction hinges on a diagnosis of breast cancer. That may sound similar, but that means that all of our patients with BRCA1 and BRCA2, all of our patients with other high risk for breast cancer, they would not have coverage for breast reconstruction under this new act. And there's no other thing that's providing coverage. So this new amendment would remove coverage for breast reconstruction for all of those patients, and that just cannot be. Another big issue with the bill is that we fought really hard to preserve access to the most modern, elegant, patient-friendly types of breast reconstruction over the last several years. And some of you guys followed along with that, and that was when we preserved what were called the S codes. This bill might undo a lot of that work because they linked breast reconstruction not to the level 2 codes, not to the S codes, but they linked it to the old codes. They said that you only had to cover breast reconstruction that was listed in the level 1 codes. I would say that this has been a challenging week to wonder, how did this happen? I'm disturbed that the bill made it this far. The fact that it's gotten this far without the input of physicians like me who do this all the time is really concerning. Only last week did I actually get to see the text of the bill. And I was surprised because the bill already had a lot of supporters, right? It already had like all these groups signing on to support it, really prominent groups. And it also had really bipartisan support in Congress. And we hadn't even seen the bill yet, like as doctors. So I read it, and right away I was like, oh no, there's some big problems here. And I shared it with some of my colleagues, and we agreed we have to change some of this bill, like for sure. And why weren't we asked to weigh in? Why was the text kept from us? Well, that may be a question for another day. I can't overstate to you the importance of this act. This cannot be undertaken lightly. We need to bring all of the stakeholders to the table. We need to protect everyone in the community and have surgeons and patient advocacy groups and patients all together with lawmakers and with societies to really have an open and transparent communication to collaborate to get the best act there is. We need to pause and we need to work together to make sure that we protect both this act and our community.